Hello, it's Declan Costello here, editor of ENT and Audiology News. We're here today to talk about the BACO conference, which will be in Glasgow between the 1st and 3rd of July 2026. I'm joined by Helen Cox, who is the president of ENT UK and chairs the BACO committee, and by James O'Hara, who is the academic lead for the Congress. Hello both, how are you?
Good, thanks. Yes, thanks for inviting us. It's
All
brilliant.
right. No, you're very welcome. We're just going to chat about a few sort of highlights and things. Tell me, Helen, first, are there any particular themes that are running through the conference that you want to bring out?
So we really wanted in this conference to try and have something for everybody. Feedback from other conferences has been that we need a little bit of what CPD do I need as a head and neck person that isn't head and neck. And so we've tried to look at that. We've tried to cater for our community colleagues without having a separate GP stream so that we can incorporate them so that we can all become one kind of happy family. And so we've got on our second day, we've got a lot of kind of back to basics stuff. And I think that was one of the themes that we wanted to bring, although that doesn't run through the whole event. We've looked very much at also being environmentally friendly and really trying to look at our carbon footprint for this meeting. Although it is a face-to-face meeting, I appreciate people will be asking about virtual. That's become difficult to do. So that's my points on it. James obviously looks at it from a slightly different perspective, and be keen to hear what he thinks.
Yeah, James, how about you?
Yeah, well, I think the first thing that we did, which may look slightly different to most other international conferences, is we've reduced the number of themes right down. So there's only 5 options for anyone to choose, and sometimes there may only be one option. And it was interesting speaking to all our colleagues in the subspecialty areas within ENT UK have really helped us put this programme together, and everybody has been supportive of this. I think we all like the idea of big audiences in the room and everyone feeling part of the lecture that's going on, rather than sparse audiences in the basement. So hopefully we're going to avoid that. It may mean there'll be standing room only in some places potentially. Look, I think we've got a really exciting programme here. And the other thing that we've really tried to do is encourage new and young speakers to get involved in BACO. I think it's really important that we all buy into our profession and recognise the importance of all the, just being a professional ENT surgeon really, and get involved in education, research and innovation. So hopefully we'll just get everybody on board with this conference, and I'm very excited about it.
Yeah, good. I mean, I absolutely agree. I like the idea of there being just a few streams running in parallel. These conferences where there are kind of 10 things going all on at once can be a bit overwhelming. And from an organizational point of view, it must be an absolute nightmare to try to set up. So I can see some advantages definitely in streamlining that. And I like your point also, Helen, about a sort of back to basics thing. I think it's very easy to get stuck when you're planning sessions. It's very easy to get stuck into esoteric, really tiny little corners of your own practice. But for something like BACO, you really want to have a bigger picture, and for somebody who's running a voice clinic in general areas or neck trauma or whatever else it happens to be, so that you've got a really good idea of a really good overview of practice. Yeah. So as always, there are some keynote speakers. Who are the keynote speakers that you're looking forward to hear, Helen?
Oh, I get to go first. That's lucky. We've got some great keynote speakers. Personally, it'd be really nice to see David Morris again. He's a contemporary, and to hear about how his career has taken off with the otology, and obviously not my area. So trying to dip into an area to understand a little bit more that will help me with my CPD and just generally managing on call, just general interest really. So it'd be great to see David. There's some great head and neck speakers. I'll let James talk about those because obviously we're both from the same subspecialty. But that would be where I.
Yeah, James, how about you? Who are you looking forward to hearing?
Yeah, well, I would say the areas of my clinical practice, but one of the nice things about this role has been going out and speaking to people and looking for new speakers and meeting new people. And I fortunately got invited to go to a head and neck conference in Bangalore and met an amazing group of surgeons there who are doing just fantastic work in robotic thyroidectomies. I'm very lucky that Athira Ramakrishnan, who is one of the leading robotic surgeons there in Bangalore, has agreed to come over, and what they're doing is just incredible. I mean, we see robotic thyroidectomy as being slightly out there. It's not something we're struggling to get this into the NHS, although some of our colleagues are doing so, whereas actually it seems to have become almost normal practice in parts of India. They've made amazing little training models to try and train people how to do the operation. So I'm really excited to hear Athira. And I'm also really excited that Rebecca Howell's agreed to come over from Cincinnati. You know Rebecca well. Rebecca's leading the pouch cohort in the United States, which is a big prospective cohort looking at pharyngeal pouches and cricopharyngeal myotomies. And I think those of us who do this type of operation realise how tricky it is for individual patients and how some of our colleagues may struggle with it. It's not an easy operation to know how to make the decisions behind that, especially as our patients get older and increasingly they all have a full set of teeth. So it'll be really interesting to see what Rebecca's got to say on that. But I'm also really excited about going and looking at some of the other areas that aren't my subspecialty areas. Interesting to go and listen to Soham Roy, who's going to talk about ethics in paediatrics. Soham's been over and supported BAPO on a number of occasions, and I'm sure those of us who aren't paediatricians will really enjoy listening to him talk. Raywyn Campbell's coming over from Australia as one of the rhinology keynote speakers, but Raywyn's also going to talk about ergonomics as well. I won't be able to mention all the keynote speakers, but they're probably the highlights. But before I forget, we do also have a gentleman called David Peters coming over, who I didn't know about. And David is an expert in peak performance, burnout, and when we met David, Helen and I, we were absolutely fascinated with the sort of things that he was discussing in the intraoperative theatre and how to introduce these. So I'm sure that will be a very popular lecture as well.
Yeah, fabulous. Okay, no, that's great. That there's plenty to chew over there. That's fantastic. In the past, there've always been practical sessions and sessions on innovation, which tend to be very popular and well subscribed. How are those going to be run at this meeting?
So we've just closed for applications for the instructional sessions. So many of those may have elements of innovation in as well, and we'll be telling applicants very soon. The instructional sessions will be from 8 till 9 in the morning. We need to make an apology, but probably not make an apology for the fact that this is a tighter programme. We can't cover everything, but then there's pros and cons of that. But we do also have industry sessions as well. So, for instance, some of the manufacturers of endoscopy equipment may be performing some of the local anaesthetic laryngology type sessions there. And I'm sure these are the areas that we will be expanding over the coming months before the conference.
Yeah.
And I think it's fair to say that we have got a really, really fascinating session where we're going to bring everybody back into the room at the end of the day. I'm not going to put any spoilers on, but if you're there on the Thursday, there's going to be some really, really great innovation led by an ENT surgeon showing some great stuff. And I'm just saying, you've got to be there.
Oh, that's a teaser if ever I heard one. All right.
Yeah, we do have 2 strategically placed sessions on the Wednesday and Thursday afternoon to stop people going to the pub. And we hope people are interested with these.
All right, yeah. Very good. The plenary speakers are very interesting. The appearance of Mark Steele, the comedian, caught my eye. Quite left field. How did that come about?
Well, it came about because I listen to Mark Steele a lot. I suspect a lot of us listen to Mark Steele's About Town on radio, and he's just hilarious. But unfortunately, Mark had oropharyngeal cancer, and I heard about this first on Radio 4 in the morning, and he actually gave some comments about some of the communication of his diagnosis, which he did in a comedy manner, but as a doctor and a head and neck surgeon, I looked at that and thought, yeah, they're the sort of things we probably should be thinking about as clinicians. So I'm sure he will provide a lot of comedy, but I suspect as a patient we will hear quite a lot of patient-focused snippets that we can take away and improve our practice from.
And as an
It
interesting
might make us
twist,
feel a bit uncomfortable.
presumably his treating surgeon may be in the room. Is that possible?
So I don't think it will be, because I think he was treated oncologically, and
Okay.
this is no secret. I think his tour, he takes around his radiotherapy mask on his tour. So I hope he feels comfortable talking to a group of clinicians who treat this. It can't be very, he's a stand-up comedian, but he's a patient as well.
Yes.
So it'll be really interesting to see, and I hope we have the chance to speak to him before the conference.
Yeah, yeah.
And we hope
Absolutely.
he doesn't go too left field.
No, well, I mean, but isn't that part of the joy of talks like that about sort of left field stuff? I think if you went completely off on a tangent, I think it would be hilarious. And what conferences are all about sort of engagement in diverse different things. And I think that would be absolutely superb. I love the idea of lots of different themes. Speaking of which, Glasgow is a very lively place, socially speaking. What are the plans for social things, Helen? Do you know?
Yeah, so we've got the Bacco party, which always, it is on the Thursday night and a standalone event. Uh, Sadly, with the cost of living, it always gets a bit more pricey each time. But anyone who came last time, great band. We're having exactly the same band,
Oh,
featuring
great.
a number of colleagues. So they'll be brilliant. And that's going to be held outside of at the venue. I forget the name, sorry, of the place. And we've got that evening as well on the Thursday. We'll have a meet with the sponsors. And on the Wednesday night, we've introduced a president's reception. There's previously been versions of this, but I really wanted to try and include all the speakers. We really value the effort people put in to speak, to pull together their agendas for the meeting. It's not easy. It's difficult to offer anything significant in terms of reductions in the cost of the meeting. And so what we've done on this occasion is we're going to have a president's reception with, I have absolutely got no idea how many people, quite a few, in the venue on the Wednesday night. Everybody who is speaking will be invited. And yeah, that's kind of what,
Very good.
it's my swan song, shall we say.
Oh, very good. And as I say, Glasgow is a very lively place. There's plenty going on. I'm sure people will be
Oh,
able to find somewhere to have a
absolutely.
lemonade after the receptions
Well,
and
that,
what have you. Do you know,
yeah.
James? Do you know Glasgow from a social point of view?
Well, as Helen will probably confer, I'm not very sociable.
I know
But
that's
I'm
not
sure
true, James.
I'm looking forward to hearing from you, Declan, because you will probably be running around the city several times a day, and you'll be able to tell me where to go from
Well,
your
that's a good
sightseeing.
point. Is there an organised run at any stage? Do we know?
Well volunteered.
We've got some organised. I think we've got some organised yoga. I
Yeah.
think we've
Okay.
got some organised yoga. I think we are thinking about a run.
All right.
I think there are still some bits that we haven't
Yeah.
fully.
Oh, well, I would certainly sign up for a run if there's one going on. Maybe not on the Friday morning after the Thursday night, but there we go.
Yeah.
Anyway, look, we'll wrap up there. Thank you very much indeed. Thank you, Helen. Thank you, James. I hope the preparations of the next few months go smoothly. And yeah, go on, James.
I will just add one more thing, if you don't mind,
Yeah, yeah.
which we haven't really talked about, which is another thing that we've done differently is we have the oral scientific program across the board. These will not be buried in the basement. Everybody will be listening to the oral scientific presentations on all 3 days. So we're really hoping that we get some really high quality scientific abstracts, which the closing date for that is in March. So if you have any research projects that you want to present, please do submit them. There will be poster presentations as well. We know how important this is for our trainees. And on that note as well, one of our main aims of BACA this year was to make this affordable for everyone. The price has come down. This is great value. I don't quite know how Amber and Kate Blackmore have managed to get the price down quite as that. I think there's been a lot of haggling going on in Glasgow.
Yeah.
But yes, we just want everyone to turn up and have a great time.
Yeah.
And there will
Great.
be prizes.
Prizes. Points mean
Prizes.
prizes. Fantastic.
Points mean prizes.
Thank you very much to you both. I hope the next few months go smoothly. I can imagine it's going to be a bit hectic for both of you, and the 3rd of July will be a moment of relaxation for you, I suspect, on that Friday evening. But thank you both very much. All the best.
Thanks. Thanks, Declan.